Welcome to the Self-Medication Assessment Tool Training Program. This is Module 3, which discusses interpretation of the SMAT scores and making recommendations based on the results. During the process of establishing the SMAT's reliability and validity, the pharmacists involved in the study made recommendations for medication management based on the patient's performance on the SMAT. These recommendations were categorized based on the degree of supervision that might be required and can be used as a guide in patient care. SMAT scores give an overall profile of the older adult's abilities. While there can be many individual differences, recommendations can be made for certain typical profiles. First, if the patient has high cognitive and functional scores of 90% or greater, a relatively high recall score of 70% or greater, and a low purposeful non-adherence score, 10% or less, then the patient likely requires no supervision. They likely do not require assistance from a family or caregiver. The use of compliance aids is optional. However, a detailed medication list or calendar is always helpful. Patients with a high functional score of 90% or greater, a relatively high cognitive score of 80% or greater, a low recall score of roughly 50% or 70%, or a purposeful non-adherence score of 12% to approximately 15% may require minimal supervision. In this case, a family member or caregiver should check adherence. They can also assist with certain routes of administration. For example, they can assist with metered dose inhalers or with injections. The next profile of SMAT scores, with a moderate functional score of 85 to 89%, a moderate cognitive score of 70 to 80%, and a low recall score of 50 to 70%, or a high purposeful non-adherence score, approximately 15% or higher, indicates a need for moderate supervision. For these patients, enrollment in a structured self-medication program in the hospital may be useful, and a simplified medication regimen is beneficial. In addition, it is recommended that a family member or caregiver fills a weekly pill organizer, or that the family member or caregiver provides support for using pharmacist-prepared compliance packaging, such as blister packs. In sum, moderate supervision can include checking adherence, assisting with certain routes of administration, obtaining refills, updating changes in prescriptions with the pharmacy, and accompanying the patient to medical appointments. A SMAT profile with a low functional score of approximately 75% or less, a low cognitive score, approximately 55% or less, and a very low recall score of approximately 40% or less, or a high purposeful non-adherence score, approximately 18% or higher, indicates that the patient requires full supervision. A family member or caregiver should fill a weekly pill organizer, or a pharmacist-prepared compliance packaging, such as blister packs, should be used. Full supervision requires that the supervision is available in the home for all medication administration times to ensure that the medications are taken by the patient or to administer the medications to the patient. Patients in this category may require further assessment by a geriatrician. Caregivers should receive and use a detailed medication administration calendar that includes medication names, strengths, indications, route of administration, and administration times. A simplified medication regimen is also helpful. There are additional considerations to make when interpreting the SMAT scores. For example, patients with low functional scores due to vision impairment can benefit from referral to an organization that provides services to the blind, the use of a large magnifier, and the use of a pill organizer that's labeled in a large font. The hospital pharmacist is advised to check with the patient's community pharmacy to determine which type of blister packaging and font size is used prior to recommending this option. With the patient's permission, results should be shared with the community pharmacist who can provide additional support. For example, a larger font size can be used on labels. In some cases, the purposeful non-adherence score can be high independent of the results on the other scales. When this occurs, patient education and a review of medication lists with the patient is recommended. It is also important to consider an evaluation of depression level in case this is contributing to non-adherence. On a final note, during testing, there was a strong relationship found between the use of pharmacist-prepared blister packs and a lower recall score. This may reflect a lack of attention to the medication regimen by the patient, or it may indicate that other persons close to the patient may have already recognized adherence deficits and arranged for the use of blister packs. The results of the SMAT assessment should be documented in the patient's medical record following the documentation standards of the healthcare facility. As a special note, for healthcare facilities that use Meditech PCS, a SMAT documentation template with automatic scoring incorporated is available from the Moncton Hospital Horizon Health Network. This completes Module 3 of the SMAT training program. Thank you.